What's up, everybody? Today we're going to talk about how to use our Tindeq testing system. And this is a great way to measure isometric strength, which is a good way to get a limb symmetry index, or if you have normative data on a certain body part or a certain joint in regards to the amount of force that that joint should be able to express in a given motion. With this, we'll go over today just how to get it set up on the iPad, how to position the patient to do a knee extension test, and then we'll also go through some examples for different shoulder positions as well. The concepts of all the different tests are going to be the same though. You just want to get them into the testing position of choice, and then utilizing the Tindeq app is pretty self-explanatory from there. At all of our facilities, the Tindeq app is loaded onto the iPad. So when you go onto the iPad, you're going to hit the Tindeq button, and the home screen that will pop up will look like this. You can do a variety of different functions with the Tindeq. The ones that you would most commonly use would either be the peak load or the rate of force development. And today we're going to show you how to do the peak load, because this would be how you would get a maximal effort isometric test, which is going to be the most commonly used test that we do in the clinic. So for this, you'll hit the peak load button. Now, if you try to start the test, you're going to get a prompt that you need to actually turn the machine on. So if you come down here, there's a button on the Tindeq, this black button. When you hit that, it will activate the machine. And when you go to scan it, you'll see that machine will populate there. So you'll select your device. And now what it's going to do, it's going to ask you to calibrate the device. So what you want to do is you want to zero or tear the device, which means we want to take all the slack out of it without any additional stress or tension on it. So with this, Erica is already placed in here. Erica, if you can extend the leg out, perfect. So right now we've got the slack out of the chains, but she's not pushing any more pressure, and we're going to zero it right there. To start the test, you're going to position them in the position. You're going to instruct them to push as hard as they can, but you don't want them to try to do that all at once. It typically works best if you tell them to try to get to their maximal effort over a 3 to 5 second time frame. So with this, Erica, what I want you to do is I want you to kick out as hard as you can, gradually build up pressure. By about 3 to 5 seconds, you should be pushing as hard as you can. And we'll start that now. As she kicks out, and you'll keep a constant tension on that, push, 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 and relax. You will see the peak load increase. It will always record what their maximal effort is. So as they're kicking out, if they're fluctuating up and down, it will always record what the highest potential they made it to was, even if they don't sustain it for the whole time. Then you can record that. If you hit the reset button or the restart button, it will bring it all the way back down to the bottom. All right, so now Erica will do a second test, and I'll have you push out, kick, 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 and relax. Good, and you'll see she was able to get up to 16.8 that time. You can record it, hit restart to clear that out. Typically with this, you'll want to do 2 to 3 repetitions, just so that way you can ensure that the device is not slipping or moving around after they start to contract. And also there is a little bit of a learning curve if they've never done it before. So getting a second and a third repetition, it'll let you know if your numbers are consistent or if you're getting any outliers that you need to throw out with that test.